Better.
Great. Okay. So hopefully this will work. So I'm going to talk to you about education, the last part of the R. And really, when we talked about where the society came from and kind of what we've expanded into, we don't want to ignore kind of the roots of education. And this is so important in disease because no matter where we came from, it is likely that our training was inadequate in venous disease. I know that certainly mine was as a vascular surgeon finishing. Why are you looking at me that way, Mark? Oh, because he was one of my educators. Yeah, that's right. Sorry. This is in the 90s, so I'm like, why is he looking that way? I'm like, yeah. I remember when I was in training, what's that?
I'm hurt.
Well, I know. So, well, yeah, that's right. So in the 1990s, I was at the VA at one point, and I had spider veins on my leg, and I'm like looking and saying, okay, how do I learn about doing something with this? And the only person at the university that did any sclerotherapy was Mark, and he didn't show me how to do it. He told me how to do it, and I used some sodium mortuate. I got some at the VA, and because we were primarily at the VA when I was a fellow, and I said, can I do this? And they said, yeah, we don't want to know about it though. You do it back in this room and you can try it. And so I had a few patients actually, because this is in the 90s, we had some vets coming back from the first Gulf War that were young, and there were a few women that had spider veins. I'm like, yeah, come back and we'll try it. So I read about it. I asked Mark and I kind of just winged it. And the first person I did, you know, there was some redness on her leg as soon as I did these injections, and I panicked. I'm like, oh my God, this is a blood clot. And I'm like, walk around, come back tomorrow. We're going to do an ultrasound. So no teaching in that, as good as Mark is. But anyway, so that was a long time ago. And you'd think, okay, things have changed a lot, and they have. But now being the senior most partner in a vascular surgery practice and having had a number of fellows come out, join us, you know, they're very good at, they've been taught well how to do a carotid endarterectomy. They need a little polishing on a few things, but they're really, you know, in the middle of the night, you're not going to worry about them treating a cold leg or something. But a lot of them are really clueless, particularly about superficial venous disease. They haven't been trained. And I'm in a specialty where this is supposed to be our bailiwick. So you know that with all of the different practices that are encompassing and people that are treating venous disease, they're learning after their fellowship and residency. Now we do want to change that, and that's part of how fellowships are changing. But this society has been so integral to many, many practices in getting the education about venous disease that's needed. It's where a lot of people learn new skills and competency. There's all kinds of changes in venous disease in the past 20-some years that where do you learn this sort of thing when your training ended back when you did stripping or endothermal and the non-thermals have come, etc. There's new innovations and new areas of controversy. Also, education puts guardrails on, coming to meetings, going to webinars, things like that. A new technology may come out, you may get really excited, you took a course, you learned how to use it, but where are the guardrails? Where is it appropriate? And something like education in this society, like AVLS, really helps with that. And then obtaining CME that is pertinent to your practice, where you get that really helps when you are in a society like the AVLS that, as you'll see on the subsequent slides, offers many different ways to obtain education. And including in this very challenging time. So a lot of things with education have changed tremendously in the past several years with the pandemic. So it used to be that besides your education that you received during your training, you'd read some journal articles, you'd go to society meetings and interact with people. Well, that rug was pulled away out from under us. And I'm very proud of the way that the AVLS pivoted to enable people to continue to get education during the pandemic. So here are some of the examples that I'm going to kind of touch on. Mark already talked to you about a lot of these, but I'm going to go into depth, a little bit more depth about some of them. So I'm going to start with the SVP because this kind of goes over several different things on that slide. So the SVP classification, Mark touched on this. This is something that was really spearheaded. It was multi-society that the AVLS really kind of drove it through. This is the pivotal paper that Mark was the principal author on. And again, we've been kind of in this jungle with pelvic venous disease of everybody describing it the way they wanted to and not having a good classification tool. So I think that the SVP is going to really change things around the world with that. And we have had it translated now into Spanish. It's been published and just now in press, but coming in hard copy in the French journal Phlebology. And, you know, maybe in the future, we'll be able to translate to some other languages as well to get more worldwide reach. I'm going to talk to you about the SVP classifier app, and Marlon showed you the phlebectomy app. This was developed in conjunction also with the AVF, and there's a SEEP classifier app as well, but I'm going to show you kind of how this is used. So not only is this a way for us to collect data, like the phlebectomy app collects data, but it's a way to teach the use of the SVP classification, and I use it in my practice a lot. And I'm to the point now where I can tell you someone's SVP score without this app, but I continue to use it so we're collecting data. But anyway, I'm going to just show you how easy it is. So an example, if you have a patient with symptoms, for example, pelvic symptoms in the vulva and the leg, that comes in, you can check what their symptoms are. So you have a screen first that you say, this is my patient, and then it gives you the S classification right there. And then the next question is, where are the varices located on imaging? And so this person, pelvis transition zone and leg. So I'll click that for my patient, and then it will have those numbers. And then this is a little more detailed, is exactly where you can check where's the pathology. So you put this in after they've had imaging. So this person, their gonadal veins, common iliac veins, internal iliac veins, and pelvic escape veins. And then whether they have obstruction or reflux, thrombotic, non-thrombotic, or congenital. So you check all the things here for each vein. It's actually pretty quick, making it look like it's not quick, but it is. And then it pops up with this classification. Okay, so it can go into your EMR or what have you. And so I think it's a very good app. And then there is a similar one that was developed also again in conjunction with the AVF for SEEP. So there's a new SEEP classification, and you can use that app to do the same thing. So besides the app, there are workbooks that we developed that allow providers to work through cases of patients, specific cases, and then they enter the classification as the case is presented. And I have an example for you. And they get CME for it. So there's a landing page where they can pick their case. There's a scoring worksheet that gives them a reminder. This is the same for SEEP. SEEP has a workbook also. Then there's a case presentation. So here's, you know, a case scenario. There'll be photos of the patient. There'll be imaging of the patient. And then you are queried with asked to fill out the SVP. And it does it one at a time, S, E, and P. And then you get 3 tries, and then you get a full explanation at the end. So very good module. Similar one again for SEEP. So these are both things that have been developed in the past couple years and offer CME and education for these important things. Now, webinars. So I don't know whether I ever went to webinars really before the pandemic, but they've become integral. And I know we're all tired of looking at Zoom screens, but we found them to be very well attended. A good way the audience can ask Q&A, and we've been doing a number of these. And I know Erin Murphy's here, she helped us recently with one this last month while she was working as the camp doctor at this camp for kids. And so we had her pre-recorded. I think it might have even been this webinar. And then she's tromping through the woods and answering questions during the Q&A. So thank you, Erin. And so Anyway, we've had a number of these educational webinars, and here's just a few examples of ones we've had recently. And then I'm going to go into next, this immersive education. So you might have seen from the other slides that we had a live sclerotherapy course again here in June, and that sclerotherapy courses have traditionally been extremely popular, but not everybody can send staff to them, and during COVID, we did not have them. So this educational immersive 360 platform was developed. We actually ordered this in our clinic, and it was exceptionally cool. I was really surprised at how awesome it was. You know, I have, my son has, we used to play VR games with, and I put them on and feel sick and all that when you're playing a VR game, but it is amazing as an educational platform to like watch people do procedures and to be in lectures. So we ordered this, our staff that are taking care of veins, so our nurses and everything did this education. And the great thing about it for me as a employer is I did not have to send my staff to a meeting when, you know, again, there was no meetings being had. So I think even in the future, you'd have the choice of going to a live meeting or doing a platform like this. And I think that this is only going to expand in the future for other things besides what we've used it for more recently. Mark brought this up, the ePass. So if you're somebody that wants to get most of your education online, and you want to get it all and know that that's going to be one of your main ways that you're going to get your CME, you can get the ePass, where you'll have access to courses, all of the webinars and short courses for one fee. And as new courses come up, you'll get fed those courses. So improving wisely, this is another, I think, educational / research piece, and this bridges both that the AVLS has done. And this is 2 different papers that have come from our society looking at practice variability in the utilization of endothermal ablation in the 2017 Medicare population. And then a follow-up saying, okay, now we had published, let me go back, this one that showed, are there outliers? What are the mean number of phlebectomies per leg per provider? And it showed kind of curves with outliers, you know, how many standard deviations above that mean. And then the second paper was to look at, does this make a difference when you let a provider know where they stand? And does it moderate or kind of bring the outliers in? And this paper did show that it does that. So it kind of was lent credence to what we were trying to do. And this, I think, is an important educational piece when we talk about those guardrails I was talking about of appropriate use. And then this, I think, so critical. And again, I'm very, very proud of the work that our society has done, and particularly Dean and his staff in this very scary time for all of us, not only from a health perspective, but from our businesses about what to do and how to navigate. So there was an incredible number of different resources available from the AVLS educationally about businesses, financial relief, PPE, where to get it, etc. And this is just an example of some of the recordings and webinars that were available or are available during that time. So I think more than any society that I belong to, and I belong to quite a few, the AVLS really stepped up immediately with help for our members and practices during COVID. And then finally, I'm going to talk again about the meetings briefly. And, you know, we have great hopes that these meetings will be well attended. We have had a hybrid meeting in, was it 2020 was the hybrid meeting?
2020 was full virtual.
2020 was full virtual, that's right. Okay, so 2020 was full virtual, and then 2021 hybrid, yes. So I think that in the future, there will continue to be hybrid meetings. And I think that, in my opinion, people who like coming to meetings and traveling and networking and seeing their peers are probably still going to come if they can. But what the hybrid meetings allow us to do is to have a greater reach. And I think that we are going to continue seeing that in the future. Today's experience notwithstanding, technology really does help get messages out to people. So I think that we will continue to see that. And what we really want to see is a good, robust, in-person meeting as well as those people who cannot travel for any number of reasons around the world can participate in the meeting as well. And then we are very proud to be hosting the UIP, and I've been doing a lot of traveling recently, and I can tell you there's a lot of enthusiasm around the world to come to this meeting. So I think that it's going to be a truly global event where we can learn from each other, and I think this is going to be great. So next year in Miami, we're hosting along with the AVF and with the Canadian and Mexican societies. So this is kind of a little bit about education in a nutshell, and even though the kind of sexy new kids are advocacy and research, remember the E, the education, kind of the foundations of where our society came from are still really, really important. Thanks.